To differentiate between allergy symptoms and COVID-19, there are a few things that you have to consider. First is, what is your risk of actually having a COVID infection? If you've been following the Public Health Agency of Canada's recommendations for physical distancing, you've been washing your hands with soap and water for at least 20 seconds, or you've been using hand sanitizer, and you've not been in contact with someone who's had a COVID infection, the likelihood of you having this infection is quite low. So that's the first thing to consider. Are you at risk of having a COVID infection? The second thing to consider is, what is your allergy history? So if allergies are typically bothersome to you at this time of year, and the symptoms that you're experiencing are typical of what you've experienced in the past, well, that might tell you that these symptoms are due to your allergy and not due to COVID. There are some features that are more specific to COVID than your allergies. The symptoms that would be more specific to COVID include potential fever, muscle aches, joint aches, and feeling quite fatigued. There are, however, overlapping symptoms for both of these diseases, and those are mostly in the upper respiratory tract, so in your head and neck. So things like a runny nose, postnasal drip, or maybe a cough after having some postnasal drip. So those would be the symptoms that would maybe overlap between the two. The third thing to consider is, what are you doing to address these symptoms? So if you have allergy and perhaps you've used allergy medications in the past and your symptoms have responded to these allergy medications, try that again and see if those symptoms do respond in the way that they have in the past. So your history of allergy, what your symptoms have been in the past, and what your response to treatment really will help guide you in this. But at the end of the day, it can be very complicated and it can be very challenging to sort of differentiate between the two. So if you're really concerned, the best thing to do is to get tested, to call 811 and make arrangements to get a nasopharyngeal swab to help determine whether or not you have the infection or not.